Life Management Science Labs would like to acknowledge that we live and produce this podcast on the traditional lands of the Wurundjeri people. We'd also like to acknowledge the traditional owners of the lands of our listeners and our international colleagues. We'd like to pay our respects to their elders past, present, and emerging. Hello, everyone, and welcome to Aging Less, the Longevity Science Insights podcast produced by LMSL, the Life Management Science Labs. We are champions of life management science, providing structured insights informed by science and inspired by practice on key aspects of conscious living. Each week, we bring you scientific and practical insights on each element with the expert knowledge of professionals in the field. I'm your host, Marie Stella, coming to your ears from Naarm, Melbourne, Australia. Let's learn together.
Hello, everyone, and welcome back to the show. As we age, staying healthy isn't just about managing symptoms. It's about staying ahead of them. Preventive care and early screening can be life-changing, especially when it comes to conditions like colorectal cancer. While it often develops silently, it's also one of the most preventable and treatable cancers if caught early. So, what should you be watching out for? What should you get screened? And what role does lifestyle play in prevention? To help us navigate this critical topic is Professor Ian Olver AM, a distinguished medical oncologist, cancer researcher, and bioethicist. He currently serves as adjunct professor at both the University of Adelaide and the University of Notre, Australia, with over 390 publications and a member of the Order of Australia for his service in oncology and public health. Ian brings deep insight into cancer prevention and care. Let's explore how early action and the right knowledge can make all the difference with Ian Olver. Hi, Ian. Welcome to the
Hello.
show.
Thank you very much. Good to be here.
It's wonderful to meet you here. Thank you very much for coming to the show and sparing your time for us. So, can you tell us a little bit about your background as a clinician and researcher? What made you choose this career?
Well, my substantive career was as a medical oncologist, and I think it's the experience you have in your early years of training when you're an intern and junior resident that influences what you do. And I found I could remember every patient with cancer that I treated in those early years, and so it became a natural progression to want to treat those people. And also, one of the things about cancer treatment is you get to sort of treat someone for the rest of their lives. And so you get to know them, and it's not just one illness and then they're gone. And I found that quite rewarding as well.
Yeah, so you have made lifelong friends throughout your career with your patients then.
Well, that's right, and then when you're doing oncology, because it was such a new specialty when I started 3 or 4 decades ago, there was plenty of research to do in terms of new drugs coming along, and a lot of research on how cancer patients cope with their illness, and some population-based research on risk factors and so on. So it was a specialty that lent itself to continued research right throughout the whole time, actually.
That's really wonderful, and it serves as a great preface for our topic for the day. But before we go further into detail, let's break the ice a little bit and get to know you a bit better. And this is a segment we call Have You Met Ian? So, Ian, what do you like to do in your spare time?
Oh, look, I have a couple of things. I like photography. I like taking pictures. I love traveling, so those two fit together. And although it might be a bit nerdy these days, I actually love reading science fiction as well. So I spent time doing that because of the different new ideas that it presents.
And you mentioned that you like science fiction. Do you read any books? What's a favorite of yours?
Oh, well, I've read a large number of the science fiction authors, but uh, there, so I think probably I started off with Isaac Asimov, and I think I've read most of his books over the time, and I think he's the one that really got me interested in ideas. And of course, he wrote a lot of fiction books as well. So he was a very well-rounded author, and I've always enjoyed reading his works.
What about films or TV shows? Do you enjoy any of those?
I actually have always liked the real estate shows on television. It always fascinates me, to look at people's houses and what people want. But in terms of films, it's a very patchy thing. I must say, I enjoyed the film Conclave just recently. I think that was a really neat
Mm.
film because it was beautifully photographed. It had an interesting storyline and had a wonderful twist at the end, and I think you couldn't want for much more than that. So, of the recent ones, that's the one I would pick.
I think with that, you would also enjoy Dune with really amazing videography.
Yeah,
Do
look,
you? Yeah.
the second lot of June that they tried to do it a few years ago and it didn't work particularly well. But this latest attempt at it has been very good, and I think probably it's the special effects that are better and probably a tighter storyline that have done it. But yes, that was a good movie.
And do you have a role model either personally or professionally?
Oh, look, I think my greatest role model was my father, who was always interested in academic things. He was always interested in people. I'm a lay preacher in the Uniting Church, and he introduced me to some of that sort of thing as well, and gave me a, a, a loving home and grounded way of looking at things, and that served me well. So he's the one that I would say has influenced me more than anything else.
One last question. What's a class or course you've taken, or maybe even taught, that has inspired you?
Oh, look, one of the most interesting things I did was when I had an opportunity to go and study bioethics, having done medicine and gone into oncology. And so to go into a completely different field like that, and particularly to cross disciplines in research and to start teaching bioethics, which I do at Notre Dame occasionally, has been the most interesting thing. And for example, I started off looking closely into aspects around the ethics of death and dying, because that was something that married with a medical career. And I just found it fascinating to look at the way different ways people approach this sort of topic and think about things. And so that's always been inspiring. And I've never regretted, uh, you know, taking on the extra study and crossing a discipline like that.
Crossing a discipline is not something that's easy for someone to handle. And how has it been for you in crossing the disciplines? What was your challenges?
Well, the challenges, actually, interestingly enough, are to learn not what the answers are, but what the questions are. And you go into a new field, and everything is foreign. Even the language is foreign. I know a lot of people, criticise doctors and so on for occasionally using medical language that the lay public can't understand. But when you go into a different discipline like, say, philosophy, they've all got a language of their own, and you sort of realize what the issue is, that you have to learn that and learn what are the important questions of the time before you can get really involved in it. And that's what I found most challenging.
Asking the right questions. And with that, I think we can dive into our topic, which is colorectal cancer prevention. So, first and foremost, how would you define longevity?
I think longevity is should be defined as living the lifestyle that it's possible for you to live with your genetic makeup and your lifestyle, so that you don't die prematurely of diseases that could be prevented. And everyone's got a slightly different genetic makeup in terms of how long they're likely to live, but living up to your full potential lifespan is what we should all be aiming at.
Could you explain what colorectal cancer is and especially its impact on our body as we age?
Yeah, look, colorectal cancer is cancer of the large bowel, including the end, which is the rectum. And it comes from the wall of the bowel, and it actually starts usually as an outgrowth called a polyp. And slowly over time, cancer cell or the cells become growing out of the control of the normal body, and they become cancerous, and then they're able to spread. And it probably takes about 10 years from the appearance of a polyp to the time it's cancerous, because you don't just need one event to cause cancer. It usually requires perhaps half a dozen hits on your genetic structure before it tips into cancer. You may have inherited some of them, but then some of them come from the environment and your lifestyle. And that's why we can actually try and prevent cancer by having lifestyle measures, particularly if you've inherited a few genes that make you more prone to that. But with colorectal cancer, it's usually thought that about 90% of them are sporadic and about 10% inherited. So I think there's a lot of potential there to use preventative measures in terms of trying to avoid the risk factors, and early screening, of course, which we'll talk about, tries to pick these things up at the level of a polyp, where if you remove the polyp, it never gets a chance to become cancerous, or if it has become cancerous, you can pick it up very early when surgery will cure, in other words, before it's spread beyond the bowel wall.
And what is the primary pathophysiology of colorectal cancer? How do they contribute to our overall health and well being?
Well, when you have a cancer, there are two sets of things that happen. One are sort of general symptoms, and the general symptoms are things like weight loss and tiredness or lethargy. And that happens with a lot of cancers. With colorectal cancer specifically, you can get bleeding from the bowel, so become anemic. You can get a blockage of the bowel, which is very painful with a bowel obstruction. And they're the symptoms of fairly late cancer. But the idea is if you can avoid those, and then and you can do things that either prevent them happening or pick them up early, you don't get those severe symptoms from well-established bowel cancer.
Let's explore how we can prevent colorectal cancer. How do dietary patterns, such as high consumption of red meat, processed foods, and added sugar, contribute to colorectal cancer risk?
Right. Well, we know that uh, there are many risks, and around the ones you're talking about, both the foods themselves and the propensity to obesity are both risk factors for cancer, and obesity is contributed to by both what we eat and also a lack of exercise. But let's look at the foods first. So there's some foods that have been linked to an increased risk of bowel cancer, and some of them are red meats, and that's because there's a lot of animal fat between the fibres that can trigger off bowel cancer. And the worst of the meats are probably the processed meats, things like
Mm.
hams and things like that, because of the way they're prepared, they're often smoked or salted or something, and that can increase their potential to be cancer
Oh,
causing. So that red meat and processed meats are things to avoid. On the other hand, of course, there are things that are helpful to prevent bowel cancer, and things like whole grains, fruit and vegetables, and low-fat dairy. A diet that is biased towards that can be very important, because you need fibre in your diet, and grains and vegetables and nuts and so on will give you that fibre, and that will help. If there is any toxic substances in your diet, will help move it through the bowel more quickly. But also fibre breaks down to
Mm.
substances like butyrate that can help prevent cancer as well. So I think there's the positives you can do of increasing your fibre by fresh fruit, vegetables and nuts, and decreasing processed foods and red meats. Now, these are not all on or none things. It's just a matter of reducing one and increasing the other. So you have a balanced diet, but you don't have too much of the things that are potentially cause bowel cancer, particularly if you know you're at risk of genetic bowel cancer because you've got a strong family history, then you'll be looking for factors that are modifiable. And that's why we spend a lot of time wanting to teach people about diet, exercise, and other things that are modifiable, because you can't pick your relatives, but you can certainly do something about your lifestyle.
You mentioned that eating fiber plays in digestion, in increasing the digestion and helping our our colorectal to process these toxic foods. And what are some examples of high fiber foods that people should incorporate into their diets?
Well, many of the whole grains are actually high fibre, so that's a good start. And many sort of fibrous vegetables have high fibre as well. The studies are more likely to be accurate if they talk about a class of things and going down to each individual vegetable. I think some people get carried away. You must eat, this particular vegetable, and I think we don't quite have the evidence for that. We've got the evidence of what sort of general foods to eat rather than, and what not to, rather than say, you must eat pomegranates because they're good for you. And I think some people have gone a little bit too far along the line of trying to pick particular foods to avoid. But we all know, just with the evidence that I've given to date, what general classes of foods will help you prevent or decrease your risk of bowel cancer.
I see. So, in regards to fiber drinks, right? There are fiber drinks and fiber supplements. What do you think about those type of supplements that people take in their bodies?
Well, look, I think the point there is that the best way of getting your fibre is by food, because that's what we were designed to do. All the things we extract from food, the transit time of the bowel because of the amount of fibre in your diet, that's the best way of doing it. Now, if for some reason you can't have that amount of fibre in your food for you might be allergic to things, or you feel sick if you eat too much of a certain thing, then some of the things that you can consume that will help you have fibre can be bought in. But I think you should start off by looking at your diet rather than just relying on supplements.
Some supplements cannot be found. It's difficult to be eaten in food. And are there specific nutrients or supplements such as calcium or vitamin D that have been shown to lower colorectal cancer risk?
Oh, that's absolutely right. But you see, a good diet will give you that. And of course, vitamin D is also processed when you go out in the sun as well. So there's your whole lifestyle. It's really about the whole lifestyle to maximize those things. And there are other things that you might do. I mean, we now know that alcohol consumption adds to colorectal cancer risk. So that
Mm.
that's something that you could do that would reduce your risk, and possibly even people are looking at whether uh, one of the other cancers that may be a problem with smoking, could be colorectal cancer. So there are other things that can be helpful. And we'll talk about perhaps about the microbiome, where probiotics like Lactobacillus acidophilus can change the nature of the bacteria in the bowel, and that can also have an influence on all sorts of things, your immune system and on your propensity to develop colorectal cancer. So there are things like that you can do as well. And when we go into sort of preventative things, there are also medications like aspirin that can be taken, and that's been shown to prevent bowel cancer as well. So it's not just a matter of picking out single vegetables and things like that. It's a matter about looking at classes of things and changing across the board.
In regards to probiotics and prebiotics, what are they and how do they aid to our gut microbiome?
Well, they're designed to make sure that there are the most effective bacteria, if you like, in the gut. I mean, there's all sorts of things that can change your gut microbiome. I mean, the most common one probably is when you take a course of antibiotics and certain bacteria get killed off and certain other bacteria are there, or you can get infections of invading bacteria. And in trying to bring that back to the normal bacteria, you can take substances that will, in fact, populate your bowel again with the bacteria that are most likely to harmonise with the body, reduce inflammation, and help the immune system do what it does, as well as providing that protective barrier. But I think what we're looking at is that we need to learn a lot more about what does affect the microbiome and how we can influence it to reduce colorectal cancer.
And can certain probiotics or dietary interventions positively impact the gut microbiome to reduce cancer risk?
Yes, absolutely. And so, particularly, well, if you have a normal, what for you is a normal microbiome, that might be okay. But if you've had things disrupted, then yes, you might have to try and alter the microbiome in order to bring it back to the healthy bacteria that your gut needs. So that's how they work. Yeah.
That's how they work. And physical activity has been linked to reduced risk of colorectal cancer. What are the mechanisms behind this protective effect of physical activity?
Well, the most obvious mechanism is that physical activity's influence on obesity. That since obesity is a risk factor for colorectal cancer, that if you're exercising and you've got a good diet, then you'll be in a normal body weight, and that risk factor will disappear. But it turns out that exercise of itself seems to be important in a range of cancers and other diseases. Some people have said that if it was a drug, it would be worth multi-million dollars because it's effective in reducing the chances of getting colorectal cancer, and it can be helpful to those who are undergoing treatment as well. Not all the mechanisms are worked out. It's observational from people that have been able to do exercise compared to those who don't.
And how do other lifestyle factors, such as maintaining a healthy weight, avoiding tobacco, and limiting alcohol intake, contribute to lowering colorectal cancer risk?
Well, just to start with perhaps the alcohol question, it was only relatively recently in the last decade or so that we've realised what a risk factor alcohol was for common cancers like bowel cancer and breast cancer. Prior to that, we thought it was really mainly a contributing factor to head and neck cancer and liver cancer, and they're relatively rare compared to the very common cancers. So that once we understood that the link was there, then that becomes another modifiable risk factor. And the trouble with alcohol as a risk factor is the risk actually starts from zero. Now, I don't want to ruin everyone's day, but low alcohol consumption is probably a fairly small risk. But once you get into the moderate or severe alcohol consumption, then that does increase your risk of many cancers, but now it includes bowel cancer. So we have to include that in one of the lifestyle factors. So rather than pick out one or the other, if you're trying to reduce your risk of bowel cancer, you'd look at your diet, and we've talked about more fiber, less processed meats, and so on. Look at the amount of exercise you do, and that really, it seems that you need moderate to severe exercise a bit. It's not just a matter of doing a few steps each day. It's a good idea to have perhaps 20 minutes of fairly rigorous exercise if you can manage it, and that seems to be associated with the good effects on a cancer, and so that gets diet and exercise, and then reducing things that are going to be harmful to you, like alcohol and smoking.
I see. So in general, it's mostly eat healthier, move more, and reduce the bad stuff in our bodies.
Yeah, I think that summarizes it very well. And because there's the other things you can't do much about, which is your genes and so on, and your gender. I mean, men are at a higher risk of bowel cancer than women. Well, there's nothing they can do about that, except perhaps they should be taking notice of the modifiable factors more than anyone else.
In understanding our bowels and our gut health, colonoscopies are often highlighted as the gold standard for colorectal cancer screening. Can you explain how they work and their effectiveness in detecting and removing pre-cancerous polyps?
Okay, so in fact, there is a step before bowel cancer screening with colonoscopy, and that is to take part in the government-sponsored bowel screening program, because the government send free kits out to everyone now from the age of 45 up into the 70s, and they do it every couple of years. And what these kits do is they're designed to test your bowel motions to see if there's any blood in them. And we're not talking about overt blood that you can see. We're talking about very microscopic blood. And what's used, what it's designed to do is to select out those people that may have bowel cancer and therefore may need to go towards a colonoscopy, rather than try and do a colonoscopy on everyone. Now, many of the people that have bleeding from the bowel might just have hemorrhoids and so on. So that it doesn't mean you've got bowel cancer, but it means that if you haven't got any blood in your bowel on this bowel screening kit test, then there's probably no need to do any more than to be screened again in the next year. And because we said that polyps take about 10 years between the time they appear and the time they become cancerous, you've got time every 2 years to pick them up if they're there, because polyps will bleed as well, and they can be detected in that way. Now, if you've had some bleeding from the bowel, that's when you should have a colonoscopy to have a look, and that will tell you how many polyps you've got, or if indeed you've got some other cause of bleeding. And if there's a polyp found, it can be easily nipped off, and that will prevent it from becoming cancerous. And then your follow-up colonoscopy depends on how many polyps you had. If you only had one or two, you might only need a colonoscopy every 5 years. But most of the population will, in fact, just start off from the age of 45 doing the bowel screening program and seeing if they've got any blood in their bowel motions, and that will select out the ones that require a colonoscopy. And the colonoscopy under a light anaesthetic is just putting a tube with a camera up the bowel and having a look at the bowel, and if you see a polyp, they can take a little snare at the end of the thing and take the polyp off. So it can be all done. It's very much an outpatient procedure, and I think the procedure itself you're not aware of. I think some people are put off by the preparation for it, which is cleaning out the bowel, but that's only a day or two before, so it's not a problem.
Other than the government funded methods and colonoscopy, are there alternative screening methods for individuals who may not be able to undergo such methods, such as colonoscopy and the government funded ones that you have mentioned just now?
Well, there's been a lot of work trying to look for a blood test that will detect bowel cancer early. And I think it's fair to say that none of them have yet reached routine practice, because what they've got to do is, yes, they might be very good at detecting bowel cancer, but they've got to be good at detecting it at the lower end when it's very small, or in fact being able to detect the polyps. And that's where the issue has been. So there's a lot of work being done to see if we can replace those things with a blood test. There's also other very clever work being done with CT scanning and multiple cut CT scanning. So you can make up a picture of the bowel by doing multiple cuts on a CT scan and putting it together to have a look at what they call a virtual colonoscopy. And that's something that is being looked at as a possible alternative. Now, it would be a very cost ineffective way to do to a population, but for a patient that, if it was available for a patient that for some reason, maybe another illness, couldn't have a colonoscopy, or is bleeding from somewhere else in the bowel, and so the bowel screening kit won't be much help. If you're bleeding from the stomach, for example, you won't be able to figure out where it's coming from. So it would be in that situation that you'd look towards other things, but they're really in development rather than in routine use at this stage.
And what evidence based strategies can people adopt today to significantly lower the risk of developing colorectal cancer?
Well, the things we've talked about are where the evidence is, so that the high fibre in the diet and the fresh fruit and vegetables more than highly refined foods, and the ability to exercise and so on. They've all got evidence behind them, looking at populations of people that do it compared to populations that don't. So we know which foods to avoid. We know which food groups to embrace in your diet. We know about exercise. There are other things you can do. And one of the other things that's been a surprise over the last few years has been how much aspirin can actually reduce, particularly in patients with a high risk of cancer. This particularly started off with those that had a high genetic risk, how much can reduce your chance of getting cancer. And this was discovered incidentally, because people were being given aspirin in the age group of, the sort of 50s, 60s, 70s, in the age group that would be relevant for bowel cancer. They were being given aspirin for cardiac disease. And when somebody looked at
Oh,
the thousands and thousands of patients on aspirin, they discovered that those that were on aspirin, if you matched them to a group that weren't in that age group, they were getting significantly less bowel cancer. So prospective studies were started, and certainly in the high risk group, it does reduce your chance. And it's not high dose aspirin. It seems that just 100 milligrams a day, low dose aspirin each day, and probably for 2 or 3 years, you may not need to take it forever, may significantly change your chance of getting bowel cancer, which is a really fascinating finding. Now, the difficulty is that there haven't been studies that have been as prescriptive in low risk cancer because you've got to balance taking something like aspirin with the risks of aspirin, that's bleeding and so on. But I think aspirin as a way of a drug to prevent colorectal cancer can be very helpful and can reduce it by quite a significant amount.
It's really interesting because usually aspirin is what we know as something that helps us with our headaches. And now there are evidence that it may help people with colorectal cancer.
Yeah,
And
well, this was
Mhm.
something, it showed up to a third reduction in mortality after 5 years of use. And what's more, even if you stop, that persisted over the next couple of decades. So it really is a useful drug to be taking if you're, certainly if your risk of colorectal cancer is high, if you've got a strong family history and so on.
What are aspirin's risks and its benefits?
Well, its benefits we've just talked about. Its risks
Yeah.
are essentially bleeding. Now, if you started bleeding from the stomach, then that's probably something that can be dealt with. But if you had, say, a vascular abnormality and you bled into the brain, that might be something quite difficult and even fatal. So although the risk of that is low, you wouldn't want to sort of willy-nilly give aspirin to everyone without recognizing there will be some people that it'll be more of a risk than others. But in the normal population, any risk of bleeding is well overcome by the strong chance of not getting bowel cancer. And there are many guidelines now, um, like the National Health and Medical Research Council, for example, that think that people in the age group with the risk of bowel cancer, roughly 50 to 70 years, could be taking aspirin to reduce their risk.
For someone hesitant about making lifestyle changes or undergoing screening, what advice would you give them to prioritize their health and preventing colorectal cancer or cancer in general?
Well, that's a very interesting question because people, it's not so much hesitant, they get used to their lifestyle, they enjoy their lifestyle, and so they've got to make changes that are sustainable. I mean, you look at the number of people that go on crash diets and it works for a couple of months and then they're back to normal after that. So we've got to find a way in which the changes that they make, they enjoy. I mean, you might actually change a few foods and so on to get towards a more risk averse diet, but you might actually find that you actually like the new foods and you're quite happy to. So do it slowly. Um, uh, Try and introduce things slowly, and it's not only the foods, it's the amount you eat as well. So it might be that you're just simply having serves that are too big. Exercise is a bit different. That has to be something that you can uh, set out to do. But then again, I mean, you might enjoy exercising if you exercise with a group, if you listen to music while you're doing it or whatever. So you've got to find out a way of making these changes that for you is sustainable, and you've got to be motivated to do it. It's not something that you can just say, well, I'll listen to an expert and I do it. You've got to want to do it for yourself, and it depends on what you see your risk as. So it's worth knowing your family history and deciding that you're either at high risk or not as to the urgency of changing these things. But public health clinicians and GPs, spend a lot of time talking to people about what they should be doing. But you've got to take ownership of it yourself and you've got to find a way to be motivated. If you know your risk factor is high, that may be motivation in itself to make these changes.
I see. And this let's flip the script. How can public health campaigns better educate people about the importance of diet, lifestyle changes, and early screening in preventing colorectal cancer?
Right. Well, I think the first thing is they've got to have definite evidence. So they've got to be able to give people the credible scientific evidence of just what the benefit is. And so, for example, we know the benefit of bowel screening. We know how many lives that can save. And as things change, the program changes. So it happens that um, bowel cancer is becoming more common below the age of 50. And there may be all sorts of reasons for that. It may be that people had a bad diet for longer than the generation above them or whatever. But we know that. So the bowel screening program, is modified to start at 45 now. So we give people that sort of information so that they know that the evidence is there, that if they do it, they know their chances of benefit from it. And the same thing with diet and exercise. We've got to actually show people the percentage benefit that they'll get from those sort of changes. So it's got to be evidence based. There's all sorts of stuff on social media, usually of simple things you can do with no evidence behind them at all. So it's worth people
Yeah.
going to or being directed to um, proper websites from good public health units and so on, so that they get the information they need to motivate them for the change. And I think one of the other things that happens, of course, is if you start making the changes and you actually start feeling better, when you've changed your diet and you don't weigh as much and you're doing exercise, then it's easier to maintain those changes. And that's the sort of message we've got to get across. And the message has to be reinforced. It's not a matter of giving it once and expecting it to do something. It's got to be something that's kept in the forefront of people's mind, and that's what good public health programs are about.
Yeah, and helping us to stay consistent in our lifestyle changes.
Yes, that's right.
What is an activity you'd recommend practicing to prevent colorectal cancer if you had to choose one?
Oh, look, I think the diet is the one that is most important. So, more fibre in the diet, fresh fruit and vegetables and nuts, and less refined foods and meats and particularly processed meats. I think that's the one that I would talk about first. Having said that, of course, early detection is also vital. So, there's a screening program there. It's free. It really is a very simple thing to do, and it can save your life.
For the screening program itself, how often should you take that screening program?
Oh, usually every 2 years is what's recommended for the screening program. Um, and because, as I say, the colorectal cancer, the development of it from a polyp is quite slow, really, in terms of being 10 years rather than just a few months. So every 2 years should be sufficient, unless you have to go on to colonoscopies, and then it'll depend on the number of polyps you have at each colonoscopy, whether are examined again in a couple of years or anything up to about 5 years.
Are there any challenges in attending these screenings?
Well, no, because the screening kit gets mailed out to your house. It used to be mailed on your birthday. I don't think that quite happens now, but from the Commonwealth Government saying that you're in the age for screening. Here's a kit. The kit is self-explanatory. It sounds as though it's unpleasant, but you've got to because you've got to sample your bowel motion, but basically, there's a very, very long stick that you use and then put it in a fluid and send it off. So it's not all that dreadful at all. And as I say,
Mm.
it may save your life. And I've known people who have said, "Oh, I haven't done it," and I've encouraged them to do it. And guess what? They had an early bowel cancer. So that uh, it really is something that's very simple, and it's government subsidised because it's very cost effective. Picking it up early before you have to spend a lot of money treating bowel cancer, and the effort and so on, and the fact that if it's spread beyond the bowel, the treatment may not be able to cure the disease. If you've got something where you can either prevent it or detect it when you can cure it surgically, that seems a pretty simple thing to do for a few minutes every couple of years.
In regards to people who want to change their diet, what would you recommend adding to their diet in response to preventing colorectal cancer?
Well, it depends what their diet is, and it may not be sort of adding. It may be just changing the proportion of things in your diet. So you might have a
Mm.
reasonable diet, but you're eating far too much carbs and refined foods, and far too little fresh fruit and vegetables and nuts. So instead of saying, "Oh, we've got to make great changes," well, just eat more of those and less of the other, and you'll be getting the fiber, you'll be getting the vitamins you need, and your chance of colorectal cancer is decreased. So it's looking at what foods, and the ones we've talked about, are going to influence colorectal cancer, and then making sure your diet has a goodly portion of those compared to the other foods.
All right. I think we have talked in length about the practices that we can do, and we can do the government screening as well. And now we can go into our open mic segment. So, Ian, this is your chance to talk about anything you're passionate about. Doesn't have to be related to the topic of our discussion, but it can also be related to it as well. The floor is yours.
Okay, thank you. Well, having been an oncologist treating cancer for such a long time, I'm quite passionate about how to prevent it. So, we've talked about preventing bowel cancer, but I'd like to broaden that out a bit and talk about some of the other cancers. And I think the one thing we can do in the community that would reduce the cancer burden most of all would be to get rid of smoking. It's not only lung cancer; it's bladder cancer, maybe bowel cancer, and others. And I know the smoking rate's been reduced to 10%, but it really needs to be zero, and that would be the one change we could make that would be really significant. The other thing that I think is important, particularly in Australia, is to be aware of our propensity for skin cancer in our climate. And so we should be aware that if we use sunscreens, we can protect our skin against the ultraviolet light, particularly during the summer months. And if we continually wear sunscreen, then the chance of developing skin cancer, not just necessarily the really bad melanoma, but just ordinary skin cancers that will have to be treated. It's a great burden on the community, the number of skin cancers we get, because people are not wearing sunscreen or just covering up with a hat, sunglasses, and clothing during particularly the most intense sun of the day. So I think they're the two things I'd like to talk about that add to the things that we've already talked about. And the other thing is we've talked about bowel screening, but there's screening for cancer of the cervix. There's So people should take advantage of that. And of course, there's breast screen. And Australia will introduce in July 2025, they'll introduce screening for lung cancer, not only in a certain age group, the sort of 50 to 70, but for those that have been heavy smokers. So we'll have a fourth screening program that the government will provide us with, and everyone should take advantage of those screening programs because it may save their lives.
Thank you very much, Ian, for joining us today. You've given us really wonderful insights on oncology, on colorectal cancer, and our diet and movements, and what we can do to prevent cancer, colorectal cancer. And if our listeners want to find out more about you and what you do, where can they go?
I think the University of Adelaide website has a bit of a précis of what I've been doing and how to contact me. But I very much appreciate the opportunity to get these messages out because they're really important.
Thank you everyone for tuning in. I hope you learned a lot, and we'll catch you in the next episode. See you later.
You have been listening to Aging Less, the Longevity Science Insights podcast produced by LMSL, the Life Management Science Labs. More episodes are available from 10 life management perspectives and can be found by searching LMSL on Apple Podcasts, Google Podcasts, Spotify, YouTube, and other podcasting apps available on your devices. If you enjoyed this episode, please rate, share, and subscribe to our channel so that other people can find it and we can continue to provide quality content. More of our work can be found on our website at longevity.lifemanagementsciencelabs.com, where you can join our movement. I'm Marie Stella. Thanks for tuning in.